So welcome to this consultation. Today we will be talking about your son's disorder and really what I want to do with that. So I'll talk about myself, ask a little bit about you guys, and then just go over like the disorder in general and all that I want to do with your son. So first, I'll talk about myself. My name is Morgan Petrosius. I graduated from the University of Nebraska-Lincoln with my major in speech-language pathology and Spanish. I've been a speech-language pathologist for around 3 years now, and I specialize in a bunch of different disorders. I've worked in schools, hospitals, in a bunch of different locations that speech pathologists can work in, and I do specialize in a lot of disorders, especially the one that we are going to diagnose your son with in a couple minutes. So yeah, any questions? No? Okay. So now I'll talk about just a little bit of the overview of how this consultation will go. So first I'll talk about what apraxia of speech is, and then I'll go to talk about the symptoms and what we really look for when diagnosing a patient with this disorder. It's different for like every age basically, but usually it's in younger children that you see it. The third one, we'll talk about treatment options, and then we'll talk about technologies that can help your son, so low tech and high tech, so technology, and also paper-based therapy. And then last but not least, I'll talk about specifically what you can do like in your home to help your son and all that good stuff. So first we'll watch a video of what your son looked like in the evaluation that we did, while kind of picking apart what we think.
Okay, Cash, can you tell me how old you are?
3.
You're 3? Wow, can you tell me your name? What? Your name's not Dad, silly. Can you say Cash? Good try. What did you do today? You swam? Swimming? Can you say bubble?
No.
Bubble? Oh, you blow? You blew bubbles in the water?
Yeah.
Can you say bubble?
Yeah.
Say it.
No.
Bubble.
Okay.
Fallon too?
Yeah.
How old is Fallon? 1. Do you guys like to go swimming?
Yeah.
What else do you like to do?
Back.
Truck? What? Oh, the park?
Yeah.
You like to go to the park? Can you say park again?
Back.
Park with a p. Park.
Okay. So that was just a little bit about what we saw throughout the evaluation and kind of just went from there. So the disorder that we did here's a little pamphlet for you guys too if you just want to look at that at all. But so the disorder we did diagnose your son with is apraxia of speech. So technically what apraxia of speech is that the brain does not connect to the mouth to produce speech sounds. So most of the time someone with apraxia of speech does know exactly what they want to say, but their brain cannot tell their mouth, lips, and like jaw and all that to produce specific speech sounds or sentences, phrases, and other kinds of things like that. So it does get frustrating most of the time because they do know exactly what they want to say but can't communicate it back to you, which leads to a lot of miscommunication. Like you saw in the video, she thought that he said truck, but he was trying to say the park. And he kind of looked around and and then he pretended he was going on the slide. So that kind of is what it looks like most of the time. And then they also, this disorder has nothing to do with weak muscles around the mouth, so no issue with that. It's all about the axons firing from the brain to the mouth to produce those sounds. So that's nothing to really worry about. And then the severity of apraxia can differ from patient to patient. I would probably say that your son has mild to severe apraxia because around his age, he's about 3 years, 8 months, he should be saying full-on sentences. People should be fully knowing what he wants to say and all that stuff. So most patients who suffer with this are born with it. Most of the time it's not anything that he does wrong or that you guys did wrong or something like that. So yeah, it's mostly they're born with it, and you can see it around the age of 1 to 3. So now we'll talk about the symptoms that we look for. So like I said, your son is around the age of, so he's 3 years, 8 months. So we're gonna look down at this category, and these are the 3 main things that we look for with people who struggle with apraxia. So the first one is distorting sounds. So it's just distortion of sounds, just how it sounds. So like the pronunciation of words is definitely not there. It's hard to understand them. It comes out distorted. So this is due to the brain not being able to connect with the tongue and the lips and all that. And then it also, so like I said before, it's not due to weak muscles. So most of the time it's just working on like the tongue and mouth, moving in the right position. And then obviously more complex words are hard to say than short, simple words. And then the second thing we look for is making inconsistent speech errors. So they might be able to like out of luck pronounce one word correctly, and you're like, oh, that's cool. But then if you ask them to repeat what they said, or like say they say a sentence and you ask them to repeat it, most of the time they won't be able to repeat it correctly again because it was just luck that they did. So a lot of repetition is hard for them. So that's another thing we look for. So just inconsistent, I can't say that even, and I'm a speech path. But so just inconsistency in speech sounds. And then the last one is groping for sounds. So groping for sounds, mostly, like sometimes people with apraxia of speech sound like they have stuttering issues because they're like really trying so hard to get the words out. So kind of what we recommend for that, especially for you guys, is just allowing them to take the time to produce that, because it's really frustrating for them if you know what they're trying to say, and then you finish their sentence. So it's just like, it's just super frustrating for them. So we really work with, like, if a lot of air is coming out and no speech sounds are coming out, that's kind of what groping for sounds sounds like most of the time. So that's kind of just the signs that we really look for, the 3 main ones, and all that good stuff. So now we'll talk about treatment options and the goals of treatment options. So the main goal is just kind of repetition, seeing the patient as much as possible on a weekly basis just to see improvement and increase the speech sounds. So the first one is articulatory kinematic approach. So this is based on the motor programming in principle. So motor programming is like the big picture. So the mouth and the mouth movement, the tongue movement, where your tongue is during each sound, because it's just like different for each speech sound you make. So this treatment option really focuses on repetition, which is kind of why we would like to see your son like 3 to 5 times a week, just for that. And then it really works on like the place and manner of articulation. So like I said, for this type of treatment, we would take out a mirror, show them where their mouth is. Like for O, it's like obviously it looks like an O. And then the mirror can also show them where tongue is. We have a ton of apps that is based for this treatment where it does virtually show the tongue and where it should be placed. So we would also do like me showing them where it is in their mouth and then them repeating back to me. The second treatment I would like to do is sensory cueing approach. So this is just a lot to do with visual and auditory, so hearing the sounds, seeing the sounds. This also has to do with repetition. Feedback is super important in this type of thing, so we'll definitely have virtual feedback for you and me that we can switch off, and you can see how he's improving and all that stuff. So a lot of the times in this type of treatment, we will do a physical movement with the speech sound. So for example, if we're working on the letter T, you could say like t, 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 t. So like eventually, like you do that like a bunch of times. So eventually we want the brain to automatically be able to say the speech sound, and then eventually we'll take out the tapping noise or whatever you would use for the physical movement. So there's like a ton of different treatment options, but these are the main two that I would use for your son. So now, any questions so far? No? Okay. So now we'll talk about the technologies that we can use or that we use with apraxia of speech. So an AAC device, have you guys ever heard of one of those? So an AAC device is super important in the speech world. So it's an augmentative device, which is, it's like a virtual voice for someone who doesn't have a voice. So in this case, since your son has trouble speaking and communicating with others, he could use one of these. There's 3 types of AAC devices: low tech, medium tech, and high tech. The 2 I would recommend the most are high tech and low tech. So first we'll watch a little video about the overall of AAC devices and just what high tech is.
Meet Dan. He is a new 7th grader at WAMS. Dan loves talking to his teachers and friends, but while he has no problem comprehending what they say, he does have trouble clearly articulating words with his own voice. So he uses an iPad as a speech device, or AAC device. So how exactly does the iPad help him communicate? Dan uses an app called Words for Life that allows him to form sentences using pictures and icons on a communication board. Sometimes it takes a while to type out those sentences, which can be frustrating for him, because he has questions to ask, answers to give, and usually a lot of jokes to tell. It is important for Dan's teachers and peers to know that it may take him a little longer to communicate, but he loves to display his knowledge and show he's learning along with everyone else. He also loves people and wants to be able to participate in conversation. Everyone has a way of communicating, whether that's speaking, signing, writing, or using an AAC device like Dan. The iPad is one of Dan's ways of communication, helping him display complex thoughts. It is part of his voice, not just a piece of technology. Teachers and friends should feel comfortable talking.
Okay, yeah, so like you saw there, that's what a high-tech AAC device is. So it could be on a computer, tablet, phone. It's very mobile, obviously a little more pricey, but technically what it is what you saw. It's just a board with a bunch of pictures. You can obviously specialize it for each patient, because whatever they do in their daily activities, you can make the board to look as what they like and do on a daily basis. And now there's another one, low tech, which is kind of what back in the day they used to use more, and you can do it homemade or whatever you like.
Hey everybody, this is Carrie Clark from SpeechAndLanguageKids.com. Today I'm going to show you how to make a communication board out of a cookie sheet and a roll of magnetic tape. I'll also show you how to use a communication board with those who are unable to speak, such as those with autism, apraxia, and aphasia. First, let's talk about what is a communication board. This right here is a great example of a communication board. It's a board that has pictures on it that represent different messages that someone may want to communicate. So for example, this message says hi. It's a picture of someone waving. So if the person that's unable to speak wanted to communicate hi, they could just point to the picture. And then you would look, as the communication partner, you would look and see, oh, they want to say hi, and then you would respond just as though they had spoken it. So this allows somebody to have a means of communication that may not already be able to communicate with their mouth. So like I said, children with apraxia or autism, adults that have had strokes and may have apraxia or aphasia, a child who's a late talker, anyone who has thoughts to communicate but is unable to speak them would benefit from a communication board like this.
Okay, so that's what a low-tech AAC device looks like. Obviously it could differ. So it could also look like one of these two down here, so you can have some that flip so they can look through them when they're trying to communicate something. or here you can see there's different categories. So if it's lunchtime and you don't know what they want to eat, they could go over, grab that, and hand it to you, and you know exactly what they want. So the main thing about an AAC device is just helping them have a voice when they don't have one. So yeah, we'll go back to the PowerPoint. Okay. So after that, I'm kind of gonna wrap things up by talking about my specific recommendations for your son and just all of that good stuff. So first, I kind of explained what we would do in therapy sessions, but now we'll talk about what you guys can do in the home with him, because the process obviously involves at home interaction with you guys, because we want you guys to be able to communicate with him as well. So like I said, I would probably recommend a low-tech AAC because it is cheaper, and you obviously saw that you can make one with a cooking pan and some duct tape and pictures that you can print out from your computer. So yeah, that will definitely help communicate at home, all that good stuff. Yeah, so a lot of the times we get parents who think that an AAC device is more setting their child back because they're not the ones speaking, someone else is for them. But actually an AAC device gives them confidence to speak, because sometimes it is embarrassing when you can't speak over and over and you can't communicate with people. So yeah, I would definitely recommend that. You could also do sign language. That's what a lot of our patients' parents do with their child, just for simple things like food or the park or anything like that, that you guys use on a daily basis. So yes, any questions so far? Okay, so this is just a little video of like overall what we talked about, treatment, what it is, all that.
Hi, I'm Kara Bartholet, pediatric speech therapist for Bundu. Childhood apraxia of speech is a muscle planning disorder that causes difficulty producing sounds, syllables, and words. The muscles of the mouth are not actually weak, rather the brain cannot properly coordinate muscle movements. In other words, the brain knows what it wants to say, but it has a hard time telling the lips, tongue, and jaw how to move in the right way to produce speech sounds correctly. Some of the distinguishing characteristics of childhood apraxia of speech may include a lack of oral motor coordination, robotic sounding speech, speech that is missing many sounds, greater difficulty imitating words on request rather than saying them spontaneously, inconsistency of sound productions. A child may be able to say something once and then not say it again. Groping with the tongue, lips, or jaw when attempting to speak, and feeding difficulties. Treatment for childhood apraxia of speech usually involves intensive speech therapy, often 3 to 5 times a week. Therapy sessions should target improved coordination of muscle movements through lots and lots of repetition, attempting to say syllables, words, and phrases. A speech therapist will work with the child to help shape speech attempts and muscle movements into clearer speech. With time and hard work, children with apraxia can eventually become competent speakers. Check out Bundu.
Okay, so that was just like the overall finishing touch, just to review like everything that we went over and all that good stuff. So now, is there any final questions? Nope? Okay. Well, thank you for coming to this consultation. I will see you soon.